I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
We're talking today about vitamin D. Now, that may not sound too exciting, but it is amazing. If you missed the first part of the show, it's on our website, drjoe.com. And we talked about the importance of vitamin D in things like weight loss, in building muscle mass. So those two things alone should excite you enough to get you to make sure your vitamin D levels are where they need to be. Now we're going to talk, and bone, we talked about bone growth as well. But there's so many other things that vitamin D does, and it's so inexpensive, it's so easy to take, and you can get it for free if you just go outside and out in the sun. Now, in the winter months, you can't get vitamin D from the sun because the angle of the sun's rays, the UVB rays, interact with cholesterol in your skin, and we just don't have a strong enough, sharp enough angle, I guess. I don't know if the right word to use there. You're not getting enough UVB rays in the winter to get the vitamin D building that you need. So that's when you definitely got to take it. But in the summer, if you're in the house a lot, if you're on your couch, if you're in an office, you don't get out for at least a half-hour a day of sunlight, then we do need to take the vitamin D supplements. But it really is amazing how many different things vitamin D does because it really is a hormone. It's not a vitamin, it's a hormone. I don't know how it got called a vitamin. Again, sunshine vitamin, some people call it. But given all these benefits of vitamin D, so many people, 40 to 80% of Americans, are lacking the amount that they need. So it's an estimated up to 95% of people's vitamin D levels comes from casual sun exposure. That's it. And you're not out in the sun for a half hour a day. I know you're not. Maybe some of you are, but most of you aren't. Most people don't spend time in the sunshine every day, and adults and children, infants are encouraged to make sure they're getting their vitamin D supplements because kids are not out in the sun either. Now, when I was a kid, when I was your age, we'd get out in the sun constantly. I mean, we'd go outside for gym. Remember gym? That was a class, not a guy. We'd go outside. We'd play hockey or soccer or whatever it was outside. After school, we'd be outside playing football or basketball, whatever. On the weekends, we're out riding our bikes. So we were outside, and today's generation don't go outside, hardly ever. And so vitamin D supplementation, I feel, would be, if I was Grand Poobah Universe, I would just put it in kids' lunches. Or make sure they get it every day. And they did a study and they found how much less expensive it was to give people vitamin D, how it affected their grades. Gosh, there was one study I read about, was it Sweden? I can't remember the exact details. But they found that if they gave a kid the equivalent of a half a grape a day, they would save money on sick time and nurse time and time out of school, and it would increase the kid's productivity dramatically, a half a grape a day. So imagine if we gave kids things like Dr. Joe's Super Greens and Dr. Joe's Essential Source every day, which is the minimum supplements everybody should be taking every day. So if you had Super Greens and Essential Source and vitamin D, oh my gosh, we'd have super kids. So the Super Greens taste great anyway, but I like in the summer, I'll mix it up with frozen bananas, some frozen fruit. I'll make a smoothie out of it just because it's cool and refreshing. In the winter, I'll just use coconut milk or almond milk. You could use water if you want to. But if up to 80% of people aren't getting enough vitamin D, and it's affecting everything from mental health to immunity to bone growth to muscle strength to fat loss, why aren't we doing this? Doesn't make any sense. It's so inexpensive too. It's made in our bodies. So again, it can be free if you get out there. But humans evolved to spend a lot of time outside. The body converts sunshine, like I said, into vitamin D. The pre-vitamin D, which is made in the skin, travels through the kidneys into the liver and bloodstreams and then is converted into the vitamin D form that we use, and it becomes a hormone. And so it's so important, but many times people are taking the vitamin D2 supplement, not the vitamin D3. Man-made vitamin D is made two ways. Vitamin D2 is created by irradiating yeast and mold. It's known as vegetarian vitamin D2. Or irradiating animal fats and cholesterol, which can create vitamin D3. Now, the vitamin D3 we use is from algae. So the algae is a vitamin D form, so it's the same benefits as getting it from an animal, but it's not an animal product because, of course, I don't eat animal products. Most vitamin D fortified cereals and dietary supplements contain a type of vitamin D2, which is neither as absorbable or convertible in the body into what the body needs, the vitamin D3. So you'll see milk fortified with vitamin D, cereals fortified with vitamin D. It's vitamin D2, folks, and it's usually very, very small amounts. Again, we need probably 4,000 to 5,000 international units a day. We're looking something fortified might have 100 international units. It's nothing, and it's vitamin D2. So it doesn't really make a whole lot of sense to me what we're doing with this pseudo fortification, I guess we'll call it. When levels are low, parathyroid becomes overactive. Hyperparathyroidism, and it can result in lower levels of phosphorus, but also increased levels of calcium in the blood. Now, my mother had high calcium levels, and a famous man once said, "Forgive them, for they know not what they do." So my mother had high calcium levels. The doctor said, well, it's probably your parathyroid, so let's remove your parathyroid. So they did surgery on her, another wasted surgery, because it did absolutely nothing to affect her calcium levels. Now, she did this without telling me, because I know a lot of times parents don't listen to their kids because we're their babies. But many, many times all we have to do is get the vitamin D levels up, which can affect the parathyroid level, which can help lower the parathyroid function from hyper to normal parathyroid, which can then balance out the calcium levels, and you don't have to have your parathyroid removed. Now, sometimes you have to have your parathyroid removed, but my approach in everything we do in our offices and all my doctors is try to do the most conservative thing first. Chiropractic care, nutrition, supplementation. If that doesn't work, we could always go a little more aggressive. Maybe we do some injections in the spine. And we have a doctor now we work with who works in our office, and we can do spinal injections, maybe PRP. PRP is we take from your own blood, we spin down the blood in what's called a centrifuge, and we take out the concentrated nutrients that stimulate growth. And then we can inject that back into your body. And so that's a PRP, and it's extremely effective for helping regenerate joints in many cases. Not always, in many cases. And so we go PRP, maybe some injections in the spine, maybe some steroids into the spine to bring down the inflammation. Then we can go a little more aggressive after that. But by the time we get to that level, we've done the chiropractic, we've done nutrition, we've done the PRP, we've done maybe some spinal injections. Most of the time, problem solved. And we could always go to the extreme, which is surgery, but I'm not a fan of surgery. I remember on our show one time, we had a friend of mine who's a neurosurgeon, and he said, Joe, I want to tell your audience, if you end up in my office and you haven't done everything that Dr. Joe said, the supplements and chiropractic and everything, he says, chances are you're not going to get better. He says, we may be able to do surgery and give you some relief, but we're not going to get to the cause of the problem. And I love what he said because he was right. Let's do everything we can before we go extreme. Well, my insurance doesn't cover supplements. It's the cheapest insurance policy you'll ever buy. Get a new insurance company then, if they don't cover what you need. That drives me nuts with insurance. Don't get me started. If you have an insurance company that sucks, get a new one. Well, my insurance company doesn't cover that, whether it's surgery or chiropractic or whatever it is. Then don't have them as insurance. What do you have them for if they're not going to insure what you need? So anyway, I digress. Back to vitamin D.
They're not going to cover anything.
Not going to cover anything, right? Exactly. So vitamin D supports the immune system, and this is something I've been pushing so hard for the past several months. UVB lights changes, the UV lights, the UVB rays affect the vitamin, produce vitamin D in your body. Emerging research shows that vitamin helps all healthy cell replication and may play a role in protecting against the development of autoimmune conditions, infections, viruses, and even things like common cold and flu. So why we're not talking about taking vitamin D supplements or getting people outside to help build the immune system, I don't know. Now, is that a cure for COVID and colds and flu and everything else? No, it's not a cure. But every show we do, we talk about things that you can do to start adding to your repertoire of health habits. And if you start doing all these things, you reduce your risk dramatically of getting sick. Is it going to totally wipe out some people for getting sick? No, it's not. But, we talked about playing the odds earlier. I want the odds in my favor, and these are things you can do to get the odds in your favor. So vitamin D seemed to help by strengthening the immune system by decreasing the ability of some viruses to replicate and grow. What do we talk about? When viruses replicate and grow, that's when they cause their problems. It's been shown to enhance the expression of an enzyme called ACE2, which is believed to have the ability to protect against acute lung injury. Okay, so it can, and that's one of the things we talked about with COVID, that if you're taking an ACE2 inhibitor, it inhibits your ACE2 production, so the virus then can get in what's called the receptor site, the ACE2 receptor site, and can kind of sneak into the body and then cause its damage. So once again, let's do everything we can to keep ourselves healthy. A study done this year found that the average vitamin D levels among residents of 20 different European countries correlated with the incidence of at least one serious acute respiratory infection. Higher vitamin D, lower respiratory infections. So it's pretty simple. Now, because it can help control inflammation, it can also benefit with chronic diseases such as multiple sclerosis, rheumatoid arthritis, irritable bowel syndrome, high blood pressure. Another benefit of vitamin D. Helps manage blood sugar and can help prevent diabetes. Now, number one question I get on the website, drjoe.com, what can I do about blood pressure? What I'd like for you to do, if you have a question, go to our website, drjoe.com, type in what you're looking for. Diabetes, heart disease, obesity, mental health issues, children, pregnancy, whatever it is, we've probably done a show on it. Type in what you're looking for, hit enter, and then we have the research there on the website. Some folks haven't gotten that message yet, and they keep sending me questions. What do I do? What do I do? And I'm happy to answer the questions. So go there and listen to the shows. So number one question we get is high blood pressure. Number two is diabetes. Diabetes symptoms result from lack of insulin or inadequate insulin production. According to research conducted at London School of Medicine and Dentistry, calcium is necessary for insulin secretion, and vitamin D benefits promote calcium absorption and utilization, therefore contributing to the regulation of insulin secretion. So the vitamin D helps the calcium be absorbed. Calcium helps with the insulin. You need the vitamin D to absorb the calcium and help with the insulin. Not rocket science. Well, was until, I guess, recently we did the studies. One study published in Current Diabetes Review, vitamin D replacement had beneficial effects on all aspects of type 2 diabetes, including the incidence control and complications of the disease. Also mounting evidence linking low vitamin D levels to diabetes. Once again, the cheapest insurance policy you'll ever buy. Help protect against colon cancer. Study published in Frontiers of Endocrinology. Vitamin D deficiency symptoms have been correlated to increased risk of cancer development, especially breast, colon, and prostate cancer. As we get older, folks, men and women, we're all more susceptible to these cancers. Researchers have found increased sunlight exposure and circulating levels of vitamin D are associated with reduced occurrence of mortality of many types of cancers. So why isn't this just being taught everywhere? Still haven't figured it out. Research shows that it can affect the risk of breast cancer, colon cancer, ovarian cancer, possibly due to the role of cell's life cycle or its ability to block estrogen. American Journal of Clinical Nutrition states improving vitamin D and calcium nutritional status substantially reduces the risk of cancer in postmenopausal women. And now some postmenopausal women don't want to get out in the sun because the sun can wrinkle their skin. That's why we have supplements. Now, when it comes to sun exposure, you got to be careful. Too much, not good. So we've done shows on sunscreen. We've done shows on sun exposure.
So it's kind of like plants.
We are like plants.
You need a little or a lot of sun, depending on what you do or what you're producing.
Yes.
Are you producing a lot of exercise, a lot of thought?
And the vitamin D helps all of that, but we don't photosynthesize.
Right. Well, I was
Okay.
going to say, I did really, really well in botany in college, but I used Khan Academy to learn about it. But Khan Academy didn't have anything on botany. They had a ton on biology.
Okay.
So I learned about biology and then transferred that knowledge into botany, which is super similar.
We all need sunlight. If without sunlight, we're all dead. Right.
The cells are...
And humans.
Yeah.
Right. And that's one of the big issues we find with senior citizen homes. They don't let them outside much. They sit inside all day. And there are some really good senior citizen homes that I like to work with, but there's some I've been to that are just disgusting. And it's just waiting to die. And they're collecting money until these people die, and then they bring somebody else in and collect their money until they die. So I'd rather get to the point where I never have to be in a senior citizen home so that I can manage my own life. And we have patients 80, 90, 100 years old coming in. Now, right around 95, 100, they usually are with a family member when they come in. But they come in and they joke and they have fun and they dress up and they're total functioning parts of society. So Olivia de Havilland just died, right? 104 it was. So you don't know who she is. You looked at me like, whew, Gone with the Wind. It's a movie made about Atlanta, here in Atlanta. I don't know. You ever heard about it? Never mind. These young kids, these whippersnappers. Anyway, I digress. But there are things you can do, and that's the thing. When I talk to my senior patients who are in their 80s and 90s and 100s, they have commonalities. They exercise. They have social interaction. They get out in the sun. They eat mostly a plant-based diet. So there are the exceptions. Well, my grandmother smoked. Well, yeah, she might be the exception, not the rule. And also, when she was younger, the water was pure. The air was clear. They ate organic vegetables, but they didn't even call them organic because that word didn't even exist. So it's a different world we're in now. So we have to work just a little harder than grandma might have had to work to stay healthy. And vitamin D is one of those things. 2018 study found helped solidify that breast cancer findings as researchers found postmenopausal women with 60 nanograms per milliliter or more of vitamin D had 1/5 the risk of breast cancer compared to those with vitamin D under 20 nanograms per milliliter. So once again, you can come to our office. We do a test called the micronutrient test. We cover a lot of different things in that test. One of the things we test is vitamin D, and we can find out really your health status by looking at that and saying, okay, you're in good shape, you're not in good shape, and this is what we need to do to get you well. And then we want to keep you healthy. One of the reasons people don't get out, I find, is pain. Of course, as I'm board certified in chiropractic, I'm also board certified in pain management and orthopedics and nutrition. But a lot of patients come to us in pain, and they've been in pain for how long? 10 years, 20 years, 30 years. I had a guy the other day. He came in, he barely walking, holding onto the wall, he's screaming in pain. How long you been like this? 20 years. So one of our doctors, I think it was Dr. Amy, took care of him, adjusted him, and the other day I saw him walking out of the office. Now, we still hunched over. It was only about 3 or 4 visits. And I said, how you doing? And he used an expletive I won't use on the air. And he said, I can't believe this. I've been in pain for 20 years. He says, I go to the VFW, whatever it was, and he says, all the guys are talking to me. What are you doing? What'd you have, surgery? He goes, no, I'm going to Dr. Joe. And a lot of people know who we are, of course, because they listen to the radio. And he says, I couldn't be more thrilled. He says, and I'm mad as hell. Because why didn't my other doctors tell me that I should have come here first? He says, I suffered for 20 years. I had to retire early. It cost me a fortune in not working in my life. He says, and one of the best things now is I can get in and out of the house easier. And so one of the problems we see when people are in pain and not outside, they're not getting their vitamin D. So if you have pain, neck pain, back pain, shoulder pain, numbness, tingling, chiropractic is the most effective, least expensive treatment for back pain. Why wouldn't you do the most effective, least expensive treatment for something? It's there. The studies are clear as day. It's not a secret. So if you have pain, I recommend you come see us first. And if it's something we can handle, we'll tell you we think we can handle it. We can't promise. If it's something that's out of our ballpark, we'll send you to somebody who is hopefully in their wheelhouse and they can work with you better. But pain is a big reason why people aren't compliant with supplements or getting outside or exercising. So if you're in pain, stop suffering needlessly. So many people have issues, and just like this guy, I hear it every day. Why did I suffer for 20 years when I could have had a very full active life? And now he's in his late 70s. He says, I could have had a full active life. The last part of my life was ruined because of this stupid little pain that nobody can get rid of except it was Dr. Amy. But all my doctors are good. You don't have to go see Dr. Amy, but they're all great. So other benefits of vitamin D. And again, in the beginning of the show, we talked about vitamin D helping muscle strength, helping with mental health, helping with bone mass, helping with weight loss. No reason not to take it. On our website, if you want to know what type of vitamin D I take, it's on the website, drjoe.com. I take Dr. Joe's vitamin D with vitamin K2.
Before you move on, maybe you could go over a little bit just what the color of your skin may have as an effect on vitamin D levels.
Oh, absolutely. If you're dark-skinned, you're not absorbing as much vitamin D. So for somebody who's really pale, like Garrett, no. Somebody who's pale-skinned, you want to do about 15, 20 minutes a day in the sun and try to expose as much of your body as you can legally, you know. I'm Italian, so I have a more olive skin. I probably need about 30 minutes a day in the sun. If you're dark-skinned, the darker you are, the more sunlight you need because you're not going to have the same effect. The UVB rays aren't going to have the same effect. So the darker skin you have, the longer you need to be out in the sun. So Garrett made a very good point there. So we're talking today about vitamin D, and it's the magic supplement that most people aren't getting enough of. It's very, very inexpensive. It's so easy to take. I take 5 drops a day. So there's no reason why you shouldn't be doing it. It's helped fight heart disease. Growing number of research points to the fact that low vitamin D levels are linked to increased risk of cardiovascular disease. Disruption of vitamin D signaling can contribute to hypertension, hardening the arteries, cardiac hypertrophy, which is the heart getting bigger. We know that humans who are deficient are more likely to die from coronary disease and other heart-related symptoms, according to research from Vanderbilt University Medical Center. It facilitates hormone regulation. This is important because so many people have hormone issues. Because it acts like a hormone in our bodies, it affects brain function. Vitamin D deficiency has been linked to increased risk of mood disorders, including depression, seasonal affective disorder, severe mood problems, people that experience PMS, insomnia, and anxiety. So we live stream a lot of these shows, and right now we're live streaming this on Facebook and Instagram. And so at the breaks, we take questions from folks watching on Facebook and Instagram. And the first question that came up today was, how does it affect your mood? And there's your answer. It helps with concentration, learning, and memory. Several studies show that vitamin D also affects your ability to make decisions, concentrate, and retain information. So if you're moody, if you fly off the handle quickly, if you're having trouble concentrating, if you don't learn as well as you think you should be doing, and not doing well on standardized tests, vitamin D is important. Additionally, some research shows a correlation between low vitamin D and increased risk of developing schizophrenia and multiple sclerosis.
So before I ever learned about vitamin D, I learned quite a bit, or I guess they go over it a lot in school, that depending on where you live and the weather, it can affect your mood.
Absolutely.
That Seattle, with higher rainfall, people are generally more depressed.
Yes.
Versus somewhere like Atlanta, which I guess lately it rains every day.
Every day. We get sun every day too, though, yeah. But there is a correlation, and we even started studying, when you look at cold and flu, if you look at the latitude, cities that are further north of the equator have higher levels of cold and flu. Closer you are to the equator, the lower the severity. So, I mean, I don't know what else to tell you. Vitamin D can support your skin. Some ways that vitamin D benefits your skin include supporting the immune system, controlling inflammation. It helps skin cell growth, repair, and metabolism. So, as we start to run out of time, some deficiency signs that you might see. Fatigue, osteoporosis, susceptibility to infections, higher risk of cardiovascular disease, high blood pressure, certain types of cancer, autoimmune disease, depression, insomnia, arthritis, diabetes, asthma, chronic pain, skin issues, and developmental issues in children. We get a lot of people calling me all the time saying, Dr. Joe, my kid isn't developing as quickly as we'd like. What can we do? And one of the things I like to do for them is do a micronutrient test, and almost inevitably, I can't think of any time it hasn't, we find a vitamin D deficiency. So it could be that the mother was deficient in vitamin D. It could be that the child isn't getting enough sunlight. They're not getting exposed to vitamin D. It's big issues. Causes of vitamin D deficiency: lack of sunlight, frequent use of sunscreen. We've talked about this a lot. If you put on sunscreen before you go out in the sun, you're not going to get your vitamin D. So what I recommend is get out in the sun for 20 minutes, a half hour, and then you can put on your sunscreen. The best, most effective thing you could do is cover up. If you're at the beach, especially if you're near locals like Florida, if you go, some of the islands in the Caribbean, you'll find that the natives wear long sleeve shirts, long sleeve pants. You're thinking, but it's hot out here. Why aren't they wearing short sleeves and shorts? Because they know that's not good for them. So long sleeve shirts, and you can get shirts now that have air flow through them. I have a great one I got from, I think it was Eddie Bauer. And when I go hiking, I wear that one so you get airflow, but it protects you. Being in a nursing home, celiac disease, Crohn's disease, cystic fibrosis, these are all people that are at risk of not enough vitamin D. Being over the age of 70, indoor occupations. Breastfed infants are also at risk of vitamin D deficiency, which is why it's so important that the mother taking the right supplements. And that's why I do recommend mothers take Super Greens, Essential Source, and vitamin D all the time. And we do customized plans for all our patients. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. We work with most major medical insurance companies, car accidents, sports injuries, attorneys. We work with lawsuits. You can make an appointment. Normally, the first visit is $375. We've reduced that through this COVID issue to $149. Exam, x-rays, consultation, first adjustment, going over the x-rays on the next visit, and a nutritional evaluation. All the supplements are on the website, drjoe.com, or come by our offices, and you can pick them up, save shipping. Folks, I'm Dr. Joe Esposito. Tell your friends about the show. We'll catch you next time. Thanks for listening to For the Health of It. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on a WSB Radio app.